Now rounding up the cardiovascular examination in pediatrics, we now look at what we call auscultation. For us to do what we call auscultation, we make use of what we call what? What's this? Good. Stethoscope. Stethoscope. The stethoscope has what? The earpiece, metal casing, the long tubing or metal tubing. Then we have the what? The diaphragm and the bell. The diaphragm and the bell. For cardiovascular examination under auscultation, we usually prefer to use what we call the bell. The bell. Okay? Because the bell picks low pitched sounds. Okay? Now, if you look at your chest, this is our chest. The bone at the neck that you can feel here is called the clavicle. That is the clavicle, the first bone there that attaches to the what? To the sternum, the manubrium of the what? Of the sternum. This bone is called the breastbone or sternum in anatomy. I'm very sure you must have heard about that. Now, the one you can feel is the clavicle. After the clavicle, for those of you that are skinny, after the clavicle, you're going to feel the second long bone. That is called the second rib. The first rib cannot be felt anatomically because it is what? It is under the clavicle. The one you can feel after the clavicle is the second rib. So second rib, third rib, fourth rib, fifth rib, and the sixth rib. Now, for us to auscultate, we have what we call the valves. The valves. Aortic valve, the aorta, pulmonary valve, pulmonary artery, tricuspid valve, and the mitral valve. We have 4 valves. Okay? This is normal physiology. I'm very sure you must have heard about these 4 valves. But our concern here is how do you auscultate these 4 valves? The first one, this is how the chest is, right and left. So the right second intercostal space, just lateral to the what? To the sternum. That is where you have the what? The first one. That's the aortic. So the aortic is between the second rib and third rib. So this space is called second intercostal space. The space between the third and the fourth is called third intercostal space. The one between the fourth and the fifth is called fourth intercostal space, and so on and so forth. So the first one, that's the aortic valve. Where is it felt? Is it felt? In your exam, if you are asked, just say second, left second intercostal space, lateral to the what? Sternum. That is the answer. The second valve is what? Pulmonary valve. Where can it be felt? At the what? Second left intercostal space, just lateral to the what? To the sternum. For the third valve, this is the third valve, tricuspid. Tricuspid valve. It is what? Between the third and the fourth rib. That is the third intercostal space. The third intercostal space, the right. So we only have one valve on the left side. That is what? The aortic valve. Others are on the right. The pulmonary, second intercostal space, the tricuspid, third intercostal space, and the mitral valve. The mitral valve, that is where the apex of the heart is located. The apex beat or the apex of the heart is what? Can you see? It is the most loudest part of the what? Of the valves. That is where we have our what? Our mitral valve. And it is located at the fourth intercostal space, just lateral to the what? To the sternum. Right fourth intercostal space, lateral to the sternum. Now, in some patients that are obese, the fats that they accumulate along the chest wall pushes the heart a little bit down. So in some obese patients, the heartbeat might be on the what? On the fifth intercostal space, right, on the right side. But for most of us, it is always on the fourth right intercostal space. That is the mitral valve. How many valves in total? 4. APTM. You'll be asked. Now, let's look at this. We have some specific signs that we check out for in children. If a child has cyanosis and clubbing, cyanosis, how do we check for cyanosis? You look at the what? At the conjunctiva. That's for pallor. Cyanosis, sclera. If the sclera looks somehow bluish, that is what? Patient is cyanosed. Or you look at the inner lips. inner lips. If the inner lips appears a little bit what? Blue, the patient is cyanosed. If the patient has cyanosis and clubbing means you look at the what? At the finger, side by side. I'll teach you that in class very well, don't worry. Okay, but just know that if a child has both cyanosis and clubbing, that child has what we call long-standing congenital heart defect. Also, and an example of a congenital heart defect is called tetralogy of Fallot. TOF means tetralogy of Fallot. Some people say Fallow. It's okay. Just know the correct spelling, okay? Tetralogy of Fallot. TOF. If a child has hepatomegaly, hepa means liver. If the liver is what? Bigger than normal. And patient has edema, swelling. Edema, maybe on the leg, on the face, there's edema. And you what? You palpate, on palpation, there's what? Hepatomegaly. Then that patient has what we call right heart failure. The right side of the heart is what? Is failing already. FTT, failure to thrive. Failure to thrive. If a child has symptoms of failure to thrive, and you check the pulse, so you check the respiratory rate, more than normal, then the patient has what we call congestive cardiac failure. Congestive cardiac failure. So this brings us to the end of the cardiovascular examination in children. If you have more questions, we can tackle that in class, but please read. 4 valves, note the location on the chest wall. Then these are the specific signs I want you to be aware of. Thank you.